Welcome everyone to CUPE Connects. My name is Deborah Maxfield, CUPE Ontario Chair of the Healthcare Workers Coordinated Committee. I'm pleased to introduce my co-host for the evening, Carrie Lynn Poole-Cottenham, who is Chair of the CUPE Ontario Social Service Sector. Welcome everyone for joining us on our Zoom live feed and on Facebook for tonight's webisode. Code Red, at risk and vulnerable long-term care in Ontario.
Thank you, Deborah, and good evening, everyone. For the last 29 weeks, we have found ourselves living and working in the COVID-19 pandemic. For decades, Labour has championed the call for more funding and the need to address the crushing workloads of frontline workers in long-term care. The combination of these issues compounded with a public health crisis in long-term care and retirement homes in Ontario. They were some of the hardest hit when it comes to outbreaks of both residents and workers, and far too many lives lost due to the spread of the COVID-19 virus. As we find ourselves on the brink of the official second wave, this webisode will take a deep dive into the issues in long-term care. Let's get started with introducing our panelists.
Candice Rennick. Candice is the Secretary Treasurer of CUPE Ontario and a former PSW in long-term care. We have Charlene Stewart with us tonight. Charlene is the President of SEIU in healthcare, representing 60,000 healthcare workers in Canada. We have Florence Mwangi. Florence is a member of CUPE Local 79 in Toronto and a frontline personal support worker.
We're also pleased to have Jackie Esmond, who is a CUPE National Legal Representative, joining us tonight, and Alessandro Presenza. Alessandro will be sharing with us his experience of losing a loved one during COVID-19 in long-term care.
So let's jump right in. We have recently we received more than 100 questions for our panel, and surely we will not be able to address them all, but we have grouped them into themes to try and cover the hot button issues in the work and the work that is underway and demand for better for our long-term care. For more than a decade, you have campaigned the Time to Care campaign to have a legislated standard of care for residents in long-term care. Candice, COVID-19 has brought to light the crisis at the bedside and many other systematic issues. Can you share some of those high-level issues and the main concerns about the lack of government's response or readiness as we enter the second wave?
Sorry, mute. Thanks so much. Really appreciate being on tonight. And I wanted you just to know a bit about me. I started to work in a long-term care facility as a CUPE member when I was 16 years old. This month actually marks 25 years since I've been a CUPE member, and I've been directly exposed to the rapid deterioration of a system that's really meant to provide dignified care to our loved ones in their final days. But my exposure isn't limited to that of a worker or a union member, but also as a daughter, as my father died in a long-term care facility just a few years ago. So I really have seen firsthand how dedicated the workers in this sector are. They show up every day, they work their hearts out in conditions that are unrealistic and untenable, and often at great sacrifice to their own health and well-being. And so to any of them who may be watching tonight, I want to say right off the bat, thank you. We see you, we hear you, and we support you in your demand for better conditions, not only for yourselves, but for the people that you care for. So CUPE and others have been ringing the alarm bells about the crisis in long-term care for over a decade. The crisis at the bedside is rooted in years of chronic underfunding, understaffing, and really the total devaluing of the lives of people living and working in long-term care, the vast majority of whom are women, many of them racialized women. And while this pandemic has shone a light on how broken the system is, these realities in long-term care have existed long before any of us ever heard of COVID-19. We know that in Ontario, in our province, we have the lowest staffing and spending levels per capita than anywhere else in the country. And despite all of the promises from the Premier and this government, we have seen no concrete action to ready or to protect these facilities from a second wave of this deadly virus. Staffing levels are unacceptably low, and this government has taken no steps to increase care levels at the bedside. Long-term care facilities need more staffing on the best of days. We can't just focus on improvements during a pandemic, which is what this government is trying to do now. And we know from the first wave that many homes operated with dangerously low staffing levels. They operated with unskilled volunteers. And while close to 7,000 healthcare workers contracted the virus, and some of them even from our own union have died, many frontline workers are continuing to work without access to proper personal protective equipment. Despite the government's own directives, members are still not getting access to the N95 masks. So if we hope to limit the spread of this virus during the second wave, then we have to learn from the mistakes of the first wave. We have to properly fund and staff these facilities. We have to ensure that those providing care are properly trained to do so. We have to ensure that workers are being adequately compensated in a way that reflects the valuable contributions that they're making. And we must demand the superior level of protective supplies to ensure that they are available to keep frontline workers safe and residents alive. They are doing nobody any good to be under lock and key. So this webisode really is coming at a perfect time because October is so critically important for seniors in our province. On October 28th, the government will debate a private member's bill at second reading. It's called Bill 13. And this bill calls for a legislated care standard of an average of 4 hours of hands-on care for every resident every single day. CUPE and so many of our partners have been calling on this for well over a decade. And if we are finally going to make this change for our loved ones, we have to win this vote. October 28th is a critical day for our province for seniors. We need you to contact your member of provincial parliament, especially if your MPP is a Conservative. And we need a commitment from MPPs that they will stand up on October 28th and they will vote in favor of this bill and allow it to move forward to third reading. And you know, I want to say that I know that it's easy for us to sometimes say, oh, someone else will take care of that or someone else will do it. I don't need to. But I want you to know that every single phone call, every email, every discussion, every meeting, it counts. They matter. We need to send a message to MPPs that the people of Ontario are watching and we need their leadership. So many people in the province are counting on it. You know, this really is our moment. There has never been more public attention on the crisis of long-term care, and we need to turn this attention into action to achieve the kind of change that will make life better for our loved ones living in long-term care. And when conditions in long-term care improve, homes and staff will be better equipped to handle a health crisis like COVID. But these improvements have to start at the bedside. We need a law that guarantees more care time for our loved ones. We can win this change and we can make life better for our seniors. We can push this government to act, but we cannot do it by ourselves. We need everyone who's tuned in tonight, our friends, our family, and everyone who cares about the state of the system to turn that care and that anger and that outrage into action by demanding that this government legislate a care standard once and for all for the seniors who built this province.
Charlene, thank you so much for joining us this evening. Many SEIU and CUPE members are working in the for-profit long-term care homes where we have seen a disproportionate number of outbreaks of COVID-19. Could you break down for us what has come to light about the for-profit model long-term care and some of the work you are engaged in to overhaul this system?
Absolutely, and thank you, Deborah, and thank you for the invitation to join this distinguished panel tonight and have a discussion over a very important issue. And it's a real pleasure to be with such strong activists in this fight for hardworking nursing home workers and all the vulnerable family members in our long-term care system. Code Red is the perfect title for tonight's session. We all know the lights are flashing and the sirens are ringing. Our long-term care system is indeed in a code red. So let me get right to it. Like Candace said, for decades, we have been sounding alarm bells in long-term care. But today, for many reasons, we are in code red. One of the major reasons we are in that code red is because the millionaires who own and run Ontario's nursing homes have an iron grip on the system for far too long. Those millionaires and their shareholders put their interests before workers and the seniors that they care for. But for the first time in decades, I really do think that iron ring that they have is slipping. COVID-19 has opened the eyes of everyday people. The people of this province have seen seniors in isolation. They've seen workers without PPE and have heard about their struggle to make ends meet. They've seen government confronted by the realities of a broken system. Thanks to the work SEIU, CUPE, and others have done to keep this story alive, and behind all that pain and suffering are large corporations that continue to fill their pockets, even as they fail their duty as service providers. Together, we have been sounding the alarm about the problems in long-term care, but now we have data and real-time facts about those for-profit nursing home corporations. These are undisputable. First, for-profit nursing home chains have 17% fewer staff than nonprofit facilities. And second, for-profit nursing home chains pay workers less money. Third, for-profit nursing homes have the worst outcomes in this pandemic. Hundreds of deaths have proven that. And through all of that, the biggest nursing home chains paid out millions of dollars in dividends to corporate shareholders throughout this crisis. Another fact, companies like Sienna, Chartwell, and Extendicare have paid out over $173,520,000 this year so far. I have to take a deep breath before I say that. $173,520,000 to shareholders so far this year. And that is money that could have gone to PPE for workers, that could have gone to increasing staffing levels, like Candace has said, that could have gone to paying workers fair wages. But instead, for-profit nursing home corporations chose none of those things. Simply put, it's a failed system. I know I have just a few minutes left, so I want to add, Candace and the CUPE team have been real partners in our collective fight to fix our broken long-term care system that puts the interest of nursing home owners ahead of workers and seniors. Together with Unifor, SEIU and CUPE stood up in the summer months when the world wanted to understandably forge ahead with life and forget about the lives lost to COVID-19. Together, we launched the Care Not Profits campaign, so our government couldn't sweep the crisis under the rug. Our emotional plea on behalf of every worker and every senior and their families was to ask the simple question of Premier Ford. Will he fix a broken system that puts profits ahead of care? Unfortunately, I think we know the answer. The good news is we have the public on our side if we have to keep the pressure up and keep the collective fight going. So if you haven't added your name yet, visit carenotprofits.ca to call on Premier Ford to step up. Again, thank you so much, Deborah and CUPE, for inviting me here today. And thank you for staying in this fight.
Thank you so much, Candace, for those very important comments. Let's take a moment and share the Care Not Profits video. So a very challenging video to watch, but imagine being on the front line and working in long-term care. And Florence, as a frontline worker, as a personal support worker, you have worked in the conditions that Candace and Charlene have described. Please share with us what life has been like on the front lines as a PSW working during this pandemic and even pre-pandemic.
Thank you for the invite to represent hundreds of healthcare workers. The pandemic caused a lot of stress and also a lot of anxiety to the healthcare workers. A lot of, for the unknown. Some cried and some prayed before going to work, even going back to home to the loved ones. Some feared and worried that they would carry the virus home and to infect the loved ones. Majority of healthcare workers separated from their family members within the same household, which was called self-isolations. The healthcare workers felt that the workload doubled as this affected them physically, mentally, even emotionally, even to witness these vulnerable residents dying every day, taking care of them, and also trying to care for them with a few staff who are on duty. There were also a lot of shortages that were experienced during the pandemic. And due to the healthcare workers calling sick due to work ban, and some also were sick, they contacted COVID. This also brought a lot of shortages at work. And this did not make things easier. It doubled the work. Members were calling each other just to walk through, to talk to each other, to console themselves, because at the end of the day, they didn't think the government was there for them. Healthcare workers also had stress of, majority of them work 2 jobs, and they were stopped and they were given the restriction of working 1. So you heard the stress level of the workload and the work itself in the pandemic, and also not having enough to take care of your family at home. So it was a lot of stress and a lot of frustrations to the members. And at the end of the day, when I know there are members who are trying to call the government, the mayor and premier, and there were no solutions given to them. So at the end of the day, today I'm here to represent tons and a lot of members. And we did appreciate the $4 that was increased, but that was not enough. That was not enough. You cannot replace $4 to compare to the work that you were stopped to work. So we are calling for the government to do something. And we are tired of being promised empty promises. He goes to the news and says how the PSW, they're doing a great job. And we keep on calling him. This is not the first time that I'm talking about the workload. I've gone to different campaigns about the workload and trying to bring adequate staff on the ground. And till today, nothing has been done. And we feel that the government is not listening at all. And what frustrates us most is even the people who are working as PSW or healthcare, they're turning now, they're trying to go to other fields. So my question is, when I get there, who will be there to take care of us? Because like no one is enrolling, no one wants to do PSW. I think even the fear that people hear about the care, the workload that goes on at work, it's frustrating. It's sad. It's sad. Let's put it that way. And we are calling out the government. They need to act. They need to listen to us. I need, as Florence knows, I need to know that someone is listening to me. There's a lot of back and forth we see from PSWs especially get hurt at work. That's health and safety. At the end of the day, we are still young to retire, but you find yourself, you can't even retire properly because you injured your back, you injured your shoulder. You still have family, young family to take care of. So this is the opportunity that we need to know that they are taking care of us. We need to know that before even the second wave comes in, we have been listened. So there's no need of promising and empty promises, because we are hard. I think I've had that for every government that comes in over 10 years, and we need support. We need to be listened for. Thank you.
Thank you so much, Florence, for sharing your experience on the front line and the frustrations that I know many frontline healthcare workers are experiencing in long-term care. And I want to welcome Alessandro. And first of all, thank you so much for joining us tonight. And I am so sorry for the loss of your father. Please share with us your experience as a family member with a loved one in long-term care during the COVID-19 pandemic, and what you can reflect on that requires change for families as we're on the cusp of a second wave.
All right, well, thank you for having me tonight. So this is a tough subject for me to talk about, but I'm going to talk a little bit about, and thank you for your condolences, by the way, I appreciate it. So I lost my father 6 months ago, and our experience in long-term care, and I'm going to speak mainly for myself. My experience from long-term care now is very, very cynical. I would probably never recommend anyone ever go into long-term care for profit care, just because I've seen on the inside what it's like. I used to spend about 25 hours a week there, and I have a younger little brother who's deaf actually, and he used to spend 40 hours a week there, and we used to alternate. And the reason we did that was because we realized when we had put both our parents in there, well, I didn't actually put them in there. I was never for it, but when someone else did, basically I realized quickly that there were big problems. So what we started to notice is that the biggest problem that we've experienced is the short staffing. That's got to be the biggest problem. And that's why we spent so much time there, because we were terrified for the safety of our parents. And as a family member, a lot of other family members were afraid to talk about those things. But I'm the kind of guy that talks to everybody, and I talk to families, and I ended up building a lot of great relationships, not just with seniors, but also with families. Well, on March the 13th, when they let us in, let me just back up a little bit. Before the Army even went in, and before March the 13th, we had made many complaints to the Ministry of Health and Long-Term Care. They have an action line, and we used to call in whenever it was short-staffed, and it was literally up to 75% of the time, almost daily. And these are all the inspection reports that I've got. These are just the ones I could find between yesterday and today. It's about 1.5 inches thick. Then I started to get accustomed with the industry, and I started realizing that this has been going on for, I didn't realize it'd been going on for 20 years. And I've got newspaper articles here that have to do with dates going back to 17, 18, 16. And I guess what I'll say is that when March the 13th came and we were no longer allowed in to see our father, because our mom had already passed away, but my father now was alone in the long-term care home. And, you know, we used to do everything for him. The PSWs were fantastic. They took care of my dad. The thing that was the hardest thing on March the 13th when they didn't let us in was that we were terrified for him. We were terrified for his safety. We were terrified for who would be taking care of him, because so many times he was not having the same people taking care of him. There was agency workers coming in, strangers that my dad used to say, "Who's that girl? I want that other girl." You know, he used to really bond with some of the workers, right? And then they'd change it up, and he'd have complete strangers in there that would be in there for a week. So this became a problem, and it became an issue that we were concerned about. But when we were not allowed in anymore, we just weren't sleeping anymore. We were just pretty afraid. And right now, on the cusp of the second wave, I've spoken to many families, and I've spoken to them, and they're terrified that this is going to happen again, and that their loved one's going to die. They're not going to be able to spend time with them and see them and hold their hand and sit with them and be at their bedside and care for them. And families are terrified. And we have social media presence all across Canada with, you know, a lot of people, and families are terrified at what is coming, and they're terrified, and nobody should have to live through that. It has impacted my life in a negative way that will never be the same. Both myself and my dad's brother and my little brother, it's just been absolutely devastating. So we are terrified for the future, that we're terrified that the second wave is going to cause more devastation. It's going to devastate more families. And I'll tell you, I've never cried so much in my whole life, literally. Yeah, so I'm worried for the other families, and that's why I'm advocating, and that's why we started a Facebook group, and that's why, you know, I've got so many good PSW friends, and we're here to say, PSWs, we love you guys. We're on your side. We support you. We thank you for taking care of our loved ones, and we hope that together we can make it better conditions for you. And that's what I just want to do with the rest of my life. I want the seniors to be taken care of. You know, they're the heroes in my life, and PSWs are the heroes too. And I'm not saying that, like Doug said, you know, doing nothing about it. We need to challenge them more, and we need like these conversations to make the public more aware of what's going on. So thanks for having me tonight, and it's a privilege to be here. Thank you.
Thank you, Alessandro. Jackie, at the peak of the first wave of COVID-19, the demands for government interventions in long-term care reached a screaming pitch. And as a result of the cries from Labour, the Ontario Health Coalition, families like Alessandro, and the opposition government, they have established a commission. Could you share with us the status of the commission, the scope, and explain how CUPE and the other Labour partners plan to monitor and engage with the commission?
Yeah, sure. And I'd like to say again, as others have, thank you so much. It's really quite an honor to be on this panel with all of you here today. The first thing that I do want to acknowledge is, yes, absolutely, this commission is happening because of the organizing, because of the demands that were made by workers, healthcare advocates, and families. And I really believe in celebrating victories when we get them, and we need to celebrate that. It's because of you. And if nothing else, the fact that the government has called this commission will ensure that there is some positive change. After all, the government is going to want to tell the commission, don't worry, we have fixed everything, everything's fine now. So we're going to see announcements like we did yesterday and today, additional funding for staffing and so on, and that's a victory too. So just a little bit about the commission. There are 3 commissioners who are leading the investigation. The chair is a judge, Justice Frank Morocco. Angela Koch is the second commissioner. She's a retired senior civil servant from the Ontario Public Service. And Dr. Jack Kitts is the third commissioner. He's a retired president of an Ottawa hospital. So the commission is still in the process of figuring out exactly how it's going to conduct its investigation, what it's going to do, but here's what I can tell you tonight. Its mandate is to investigate COVID-19 spread within long-term care homes, to look at how residents, staff, and families were impacted, and the adequacy of the measures that were taken to prevent, isolate, and contain the spread. So that's the mandate. So the commissioners will be looking at things like infection prevention policies, physical infrastructure, staffing, labor relations, and clinical oversight. Its ultimate task is to provide the government with guidance, probably through recommendations on how to better protect long-term care residents and staff from outbreaks in the future. It's operating on a very short time frame. So its final report is due on April 30th. That's 214 days from today. And that short time frame, I'd say, is good and bad. It could be interpreted in different ways. It could mean that this government wants to act swiftly to address the problems in long-term care, or it could mean that the government is just going through the motions, making it look as though it's doing something without adequately resourcing the commission. Either way, it's up to us to use this opportunity to make this commission meaningful. And CUPE has put together a team to participate in the commission's process and is working with labor partners like Charlene. What that participation is going to look like is still a bit unclear at this time. The commission hasn't decided if it's going to hold public hearings, which are really common in other commissions and inquiries. They might do so in what they're calling the second phase. But in the first phase, what they're doing is they're meeting with labor, with academics, with government representatives of families to educate themselves. And if you're interested, there are transcripts and presentation materials from some of those meetings on the commission's website. And CUPE is scheduled to have our first meeting with the commissioners next week. The commissioners have signaled really clearly they know there's a second wave. They think it's important to put out an interim report with some concrete recommendations of what needs to be done now to prevent what happened already in the first wave. So that's going to be the focus in the initial stages. In terms of CUPE's priorities, I would say CUPE's first priority is to ensure that the commission hears directly from frontline workers. The only people who really know what happened in long-term care homes are the workers. And they know what went wrong and they know how it can be fixed. A second priority is the commission needs to understand that the tragedy that unfolded in long-term care was the result of years of neglect, as everyone before me has already talked about. Alarms were raised for years. COVID may be new, but the problems are not. So CUPE will be calling for major structural changes to improve the living and working conditions for residents and staff of long-term care homes. That means things like proper funding, public ownership, minimum care standards, good jobs, access to PPE, and a Ministry of Labor that doesn't completely abdicate its role to protect workers, amongst other things. Those are some of the things that we'll be talking about with the commission. And finally, I'd say CUPE's priority is to make sure that this isn't just another commission that makes a bunch of really nice recommendations that go nowhere. There are already many studies, reports, recommendations that are gathering dust. So what that means is our work doesn't end when the commission delivers its report. We will need to continue to fight and organize to make those recommendations a reality. And if we don't, then that would mean that the commission's report is just another book on the shelf, another great paperweight. That's not what we want, and it's up to us to make sure that doesn't happen.
Thank you, everyone, for sharing your perspective and insights on the state of long-term care, leaving the residents at risk and vulnerable. COVID-19 has been highlighting Rod bringing all systematic issues into the public realm, where Ontarians are looking for how we can change the system for the better. So my question is, what are some of the concrete steps that we can take to improve the conditions in long-term care for both residents and workers?
Candace, let's get started with you.
Okay, thanks so much, Carrie Lynn, and really thanks to all of the panelists here tonight. I think you've all been really great. Thank you so much. First and foremost, I guess I would want to ask people, don't forget, when life starts to normalize and you get busy doing your other things and life takes over, please remember that there are tens of thousands of seniors and workers providing their care who are really struggling and suffering in long-term care facilities, and they need our help. Many of them don't have voices, and we need to be those voices. I talked about October and how important October is. October 28th, the government is going to be debating Bill 13 at second reading. This is the bill that calls for a legislated guaranteed staffing standard of 4 hours for every resident living in long-term care. This is a law that we have been calling for and asking for well over a decade. This is our moment to get this bill passed. We cannot let this moment go by without doing everything we can to ensure we are applying pressure on our members of provincial parliament and asking them to stand up for seniors in the province and do the right thing. We need to have Bill 13 passed. On October the 8th, there's going to be a day of action across the province organized by the Ontario Health Coalition. We're calling people to go to MPP offices at 11 o'clock in the morning. There's going to be a car caravan to respect social and physical distancing and the restrictions in the province right now. Please show up in your vehicle, carpool, be there to show your support and to let our elected folks know that we're not backing down on this, and we expect and demand action from them. For talking points or to involve yourself in the campaign, you can visit qp.on.ca/time-to-care. If you're a family member, ask questions about staffing levels, ask questions about safety, demand care levels and proper and adequate care levels for your loved ones. If you're a worker, know your rights, exercise those rights. Call on the government to repeal Bill 195, which is taking away the rights of frontline workers under the guise of a necessity under the pandemic. Some of the rights that have been taken away from workers are being taken away in facilities where they haven't ever seen a case of COVID. And lastly, if you want to involve yourself in the commission and you're a long-term care worker, you should reach out to us and talk to us about how you can have your voice and your stories heard. We are actively working to do everything we can to ensure that frontline voices are heard at the commission and taken seriously, and that frontline workers can engage in this process without fear of reprisals. So, first and foremost, get involved, be active, have your voice heard, and know that your voice can make a difference, and we need your help.
Thank you, Candace. Charlene, concrete steps.
Yeah, well, wow, I agree with everything that Candace said. But, listening to what she said, I'm thinking, this pandemic comes around every 100 years. And I really think that we might have an opportunity that we've been waiting almost 100 years to see some results in. Again, I tell people that this problem really does take a village. It takes everybody. And it's so great to see, the personal support workers on tonight, the family members. None of us can do this alone. And I think for the first time ever, we have got our arms linked. And first and foremost, we cannot drop the ball. And again, as is often repeated, and again, I say it bears repeating over and over again, and many of you will know, I agree with the words of the elder expert, Pat Armstrong. Her famous words, the conditions of work become the conditions of care. This tells us what we can't expect, keeps repeating that we can't expect quality outcomes with the continued exploitation of workers. And that's the bottom line. Workers have been exploited in this sector for decades. And I say, while the challenges we face right now are very complex and might seem overwhelming, the boldest solutions, in my view, are really, really straightforward. And it will come as no surprise to the people on this panel. Number one, give workers full-time jobs with benefits like paid sick days and a pension. Because after a career of serving our communities, they deserve the security in their own retirement. All of us, we just, get into a career. We want to have a secure full-time job so that we can raise our children. Hopefully they can go to college and then we can retire with dignity. Give workers a permanent wage increase so they can afford to raise a family and not be forced to choose between paying rent or paying for their own prescriptions. Again, a full-time job with full-time wages. And like Candace said earlier, increase staffing levels to create safe workplaces that give seniors the dignified care that they deserve. And fourth, end the failed experiment of for-profit long-term care. None of this can be done tomorrow, especially the for-profits, but we have to start phasing them out. It's time that people take a really hard look at what we're all about. And I will never agree that taking care of seniors should be a way for any multinational million-dollar corporation to make money on those lives. We're Canadians and we can do better than this. And it takes a village, and looking at the people on the panel, the village is already fired up. So again, full-time work for people so that they don't have to work multiple jobs, wage increases, sick pay so that they don't go to work sick, staffing levels so that they can work to get to retirement, and get rid of those for-profit care homes.
Thank you, Sharon. We'll take Florence next. Florence? You're muted, Florence. There you go.
Sorry about that.
That's okay.
For me, I'll just think the first thing I would wish is to see the staffing level being tackled, because when I know the staffing are added, that means the workload goes down, automatic. And we don't have to have an assignment that you have like 10 to 11 or 12 sometimes to take care of. We need to bring dignity and respect back to the vulnerable. We need to take care of them as we wish. When we grow old, we should be taken care of. That's all we are asking for, because when I go to work, and I hope that we don't have shortages, because that affects it affects the workload too. And sometimes you think people call in sick because of they want to call in sick, as the way managers will put it, but it is the frustrations, it is the stress, it is the burnout of work. It's all together put together. You end up calling in sick because you need to regenerate yourself to have the energy again to work. So workload comes first, and they need to check about the assignments as it is in the homes, because in the morning shift, you're given a shorter time to get them up. And in the afternoon too, you're less staff on the ground, and you're supposed to put them back to bed. So what the residents are requiring to be done, or the care that all the family members are expecting the resident to be taken care, definitely we are not going to get, because we don't have the time to take care of. And at the end of the day, it's us who deal with it, because the family members come to us as the staff, and also when the residents are calling on to ask for help, it's us. So workload is number one that needs, and that comes with the staffing level. We need to take care of that first, for us even to know that even the government is listening to us.
Thank you, Florence. And perhaps the crushing workloads being addressed would help also with the recruitment and retention of folks entering the field and being appreciated and valued and compensated properly, for sure.
Yes.
Alessandro, what are your concrete steps that we can do to improve the conditions for both residents, workers, family members in long-term care based on your experience?
So before coming here on the call, I actually did a little research. I threw a message out to some PSWs, and I wanted to ask them what they felt were the two most important issues. And I got quite a few responses. And the issue that kept coming up was the two biggest issues are hands-on time for residents and full-time jobs. Those are the two biggest issues that came up. There's no reason why a PSW should be treated like any differently than anyone else. They should have a full-time job. And I think the concrete steps that I'd like to see are steps taken to protect our workers and to stabilize the workforce so that they can live, also that they can live with dignity and they can have a full-time job and they don't have to earn just a little bit more than someone at Tim's. And I was in nursing homes and I saw all the work they did, and I would definitely advocate for a minimum starting wage of, I may not be the expert on this, but they should all be starting at like 25 and up or something, in my opinion. And then the ones with senior, maybe more, I don't know, but there's no way they should be getting just over minimum wage. That to me is the first step that needs to be taken. And I think that I'd like to see, and I say this with all humility and due respect, I'd like to see the unions push that harder at any bargaining opportunities they have, because the unions have so much, technically they have a lot of power too. So that's one thing I'd like to see. The second thing is a permanent and stable workforce. No more part-time, no more volunteering, no more agencies coming in and taking shifts and jobs away from the workers. Give them the first opportunity. When someone calls in sick, call up the PSW. Someone says, well, there's a shortage of PSWs. Well, there is now, because they created the shortage by providing such horrific work conditions for them. And I'd like to just read something just really, and maybe I won't read it, I'll just refer to it. In February, there was Ontario launched an external advisory group to provide strategic advice on staffing in the long-term care sector across the province. And the advisory group is made up of experts, academics, thought leaders, stakeholders, including the resident and family voice across the long-term care sector. I mean, what are thought leaders exactly? Thought leaders, I've never heard that term, but I'm assuming it's for-profit owners. And then and then it says on the advisory group that there was going to be resident and family voices across the long-term care sector. And then later on, Doug Ford appointed the staffing advisory group, which excluded union members. However, rather than address recommendation 85, the advisory group recommended against regulating a specific staff mix or staff to resident ratio. So we need staffing ratios, we need 4 hours minimum, and we also need the ratios of workers to residents, not just the hours. The other thing I'd say is stop all the casual. Just, more people would be coming back into this industry. We have a crisis now, but more people would be coming back into this industry and working in this industry if they knew it was a secure job. But there's no job security now. And also, I think we should stop contracting out all these contracts like food, laundry, house cleaning. Bring those into and under the full-time permanent positions, and instead of farming those out to all these, all these private sort of secret relationships that they've got going. And of course, the last thing is penalties for infractions that are painful, not just inspection reports, but I mean financial penalties, and last of all, lawsuits, lots and lots and lots and lots of lawsuits. So that's the only thing that we've got left as families. They've left us with no recourse. accept to do this, because this has been a problem in 2008 under the Liberal government, and the same thing happened when, again, in just 2020. And this is just both of these parties are just basically listening to the lobbyists. And I think we need to get the politics out. When we have these committees, there need to be arm's length advisory committees, independent, not like we have on the commission, which I'm thankful there is a commission, but the commission, if it's just chosen and it's not third party arms length independent, it's going to have the same impact. And it would be like asking an Italian food company that produces cheese to do a study on whether cheese is better than, you know, bologna and salami. Well, if you ask the cheese company to do the report, it's not going to be very objective. And I know it's a little bit of a bad analogy, but we just need to have I think we need to have the unions represented there to balance the power on these advisory committees and on these commissions. So that's sort of what I would say.
Thank you so much, Alessandro. Always good to have a food analogy when we've been, you know, holding off eating our dinner, and but definitely for your perspective and insight as a family member who, you know, has lived experience as a family member, but has been able to really look at the system as a whole and identify those challenges that are faced by residents, families, and workers. So thank you for that. Jackie, final thoughts on concrete things that we can do to make a difference in long-term care?
Sure. I guess the first thing I'd say is, as a CUPE lawyer, my first job is to listen to the experts to tell me what the problems are and what the solutions are. And the members who are working in long-term care, like Florence, you're the experts, not me. So I listen to you. So the kinds of recommendations that I talked about that CUPE will be making at the commission, those are drawn from that very deep well of worker knowledge. What I love about the way that you framed the question is that you linked it, what's happening in long-term care, to systemic issues more generally. And I wanted to pick up on that, because of course what happens in long-term care is a reflection of the wider world as well. I think we've seen very painfully the ways in which COVID-19 has highlighted systemic inequalities in the world. The tragedy in long-term care reflects that as well. We know without a doubt that the pandemic has had harsher and deeper impact on racialized and low-income communities. And racism in the labor market is absolutely one of the reasons for this, where we see Black, Indigenous, and people of color being overrepresented in precarious jobs and unsafe work. And work that's seen as women's work is underpaid, with a gender wage gap that sees racialized women earning 58 cents to every dollar earned by a white male worker. So all of these intersections really come together in long-term care, where caring work is so devalued that homes have been able to get away for years with providing part-time, temporary, low-paying, and unsafe work. So and this really echoes what you know the great speakers before me had to say, is that one of the first and most important concrete changes that need to be made is to improve those jobs in long-term care, to recognize and value the incredible skill of workers in those jobs, and make those good jobs with full-time hours, well paid, with benefits, pensions, and so on. And that will ensure not only better care, the best possible care for residents, it will reduce infections, and it's also just part of the critical anti-racist work that we need to be doing right now. And we need to be drawing those connections.
Thank you so much, Jackie, for connecting that on such a much higher systemic level for us. And I want to thank Candace, Charlene, Florence, Alessandro, Jackie, for joining Deborah and I for this episode of CUPE Connects. Thank you to the hundreds of people who watched on Zoom and on Facebook Live. We do post the recording of this on the CUPE Ontario CUPE Connects page, so you can share it in a few days of tonight's live broadcast. And I would be remiss to not plug the next webisode of CUPE Connects, A Just Recovery for All, Reimagining the Future, is currently being planned with Elise and Tiffany as the co-producers of that webisode that will air the week of October the 12th.
Thank you everyone for joining us and have a great night.
Thank you.